Welcome to Special Education with Hamid Naqvi. Let's continue practicing MCQs relating to mentally challenged field. The first MCQ is: which assessment is used to measure adaptive functioning in areas like communication, socialization, and practical skills for diagnosis and treatment planning? The options are MMPI, Denver's Developmental Screening Test, Will-Land Adaptive Behavior Scales, or Beck Depression Inventory. The answer is Will-Land Adaptive Behavior Scales. And we know that Will-Land Adaptive Scales assess adaptive functioning across areas crucial for independence and are used in diagnosis and intervention planning. Next MCQ is: which of the following intellectual disabilities results from a deficiency in enzyme phenylalanine hydroxylase? Tay-Sachs disease, phenylketonuria, Down syndrome, or Cre-du-Chat syndrome? The answer is phenylketonuria, which is in short called PKU, and a PKU is caused by deficiency in enzyme leading to intellectual disability if not managed by a strict diet to limit phenylalanine intake. Next MCQ is: what is the primary focus of Special Olympics programs for individuals with intellectual disabilities? Options are competitive exams, academic tutoring, social and physical development through sports, or career counseling. Answer is social and physical development through sports. Special Olympics, we know, provides sports training and competition to promote physical fitness, self-confidence, and social integration for individuals with intellectual disabilities. Next is: which adaptive skill is essential for promoting independence in daily life for those with intellectual disabilities? Singing, academic skills, self-care, artistic skills. Answer is C, that is self-care. And we know self-care skills such as dressing, grooming, and eating are fundamental adaptive skills that foster independence in individuals with intellectual disabilities. Next is: which approach to treatment aims to teach individuals alternative ways to express their emotional instead of engaging in challenging behavior? Psychodynamic therapy, behavioral intervention, cognitive therapy, or medical treatment? The answer is B, that is behavioral intervention. And the reason is behavioral intervention techniques such as positive reinforcement teach individuals with intellectual disabilities alternative, appropriate ways to express emotions and reduce challenging behavior. Next is: which of the following is a characteristics of individuals with mild intellectual disability? Can live independently with minimal support, requires full-time care, unable to communicate verbally, or shows significant delays in all developmental areas? Answer is the first one, that is can live independently with minimal support. Individuals with mild intellectual disabilities are often capable of living independently or with minimal support and may have some delays but can acquire many basic skills. Next MCQ is which category of adaptive behavior skills includes communication, following directions, and literary skills? Options are conceptual skills, social skills, practical skills, or creative skills. The answer is the first one, that is conceptual skills, because we know conceptual skills involve understanding language, reading, and following instructions, which help individuals communicate and function in daily life. Next is which of the following sports involves providing help only when an individual with intellectual disability requests it? Continuous support, crisis intervention, time limited support, or intermittent support. The answer is the last one, that is intermittent support. And we know intermittent support is provided only as needed, often in response to requests or specific situations, allowing individuals more independence while still having access to help. Which of the following is a significant risk factor for intellectual disabilities? High socioeconomic status, good prenatal care, exposure to environmental toxins, high levels of physical activity. Answer is C, that is exposure to environmental toxins. Exposure to environmental toxins such as lead or mercury during pregnancy or early childhood can increase the risk of intellectual disabilities by affecting brain development. Next is which area of adaptive functioning involves managing emotions, building relations, and understanding social norms? Conceptual skills, emotional skills, social skills, or academic skills? The answer is social skills. We know that social skills are essential for managing interactions, understanding social cues, and building relationships, which help individuals with intellectual disabilities navigate social environment. Which of the following developmental assessment is often used to evaluate young children at risk of intellectual disability? Beck Depression Inventory, Stanford Binet IQ Test, Denver Developmental Screening Test, or MMPI? Answer is Denver Developmental Screening Test. The Denver Developmental Screening Test evaluates developmental milestones in young children, helping to identify delays that may indicate an intellectual disability. Next MCQ is which of the following is a potential cause of intellectual disability relating to prenatal factors? Traumatic brain injury, lead exposure in children, maternal alcohol consumption during pregnancy, poor nutrition during adolescence. Answer is maternal alcohol consumption during pregnancy. Alcohol consumption during pregnancy can lead to fetal alcohol spectrum disorder, which are associated with intellectual disabilities and developmental delays. Next, which term describes the gradual loss of intellectual functioning over time, often due to genetic conditions like Rett syndrome? Progressive intellectual disability, acute onset, developmental regression, spontaneous recovery. Answer is developmental regression. And developmental regression, we know, refers to the loss of previously acquired skills, which can occur in conditions like Rett syndrome, where intellectual and motor skills deteriorate over time. Next, which assessment tool is specifically designed to measure adaptive behavior skills in individuals with intellectual disabilities? MMPI, Vinland Adaptive Behavior Scales, Stanford Binet Intelligence Scales, WISC, that is Wessler Intelligence Scale for Children. Correct answer is second one, that is Vinland Adaptive Behavior Scales. And we know it that Vinland Adaptive Behavior Scales measure adaptive behaviors which include communication, daily living skills, and socialization, helping in diagnosis and support planning for individuals with intellectual disabilities. Next is which of the following is not typically associated with intellectual disability? Learning difficulties, limited adaptive behavior, significant impairment in general and mental abilities, or advanced problem solving skills. Answer is the last one, that is advanced problem solving skills. Intellectual disability is generally associated with challenges in problem solving and cognitive functioning, not advanced problem solving skills. Next is which behavior management technique involves reinforcing desired behavior while ignoring or not reinforcing challenging behavior. Task analysis, positive reinforcement, differential reinforcement, or punitive measures. Answer is C, that is differential reinforcements. And we know differential reinforcement focuses on reinforcing desirable behavior and reducing challenging ones by not reinforcing them. A common strategy used in managing behaviors in individuals with intellectual disability. Next is which type of intellectual disability is often associated with maternal meiotic non-disjunction leading to an extra copy of chromosome 21. Turner syndrome, Fragile X syndrome, Down syndrome, or Klinefelter syndrome. Answer is Down syndrome, and the reason is Down syndrome is caused by an extra copy or chromosome 21, often due to non-disjunction during maternal meiosis, leading to intellectual disability and characteristic physical features. Next is which intervention strategy is frequently used to help individuals with intellectual disabilities learn new skills through repeated practice and positive feedback. Cognitive restructuring, skillful requisition training, pharma, pharmacotherapy, electroconvulsive therapy, electroconvulsive therapy. Correction. Answer is skill acquisition training. Skill acquisition training involves repeated practice and positive feedback, helping individuals with intellectual disabilities develop new skills by reinforcing success in each step. Next is which characteristics is often seen in individuals with Williams syndrome in addition to intellectual disability. Shyness and social withdrawal, strong language and musical abilities, aggressive behavior, lack of interest in social interaction. The answer is strong language and musical abilities. Individual with Williams syndrome often displaying strong verbal and musical abilities in addition to intellectual disability and a friendly sociable personality. What is the primary goal of transition planning in educational programs for students with intellectual disabilities? To focus solely on academic achievements, to prepare for independent living, employment, and community participation, to ensure placement in special education classes, or to minimize contact with non-disabled peers. The answer is to prepare for independent living, employment, and community participation. The transition plan we know helps students with intellectual disabilities develop skills necessary for post-secondary life, including independent living, employment, and integration into the community. Next MCQ is which method uses pictures, symbols, or visual aids to help individuals with limited verbal abilities communicate effectively? Answer is auditory processing techniques, PECS, Picture Exchange Communication System, Sign Language Instruction, a Written Language Program, and the answer is PECS, which stands for Picture Exchange Communication System. And PECS uses pictures to help individuals with limited verbal abilities communicate by selecting images that represent their needs, facilitating intercommunication. Which areas of intellectual disabilities intervention focuses on building basic daily skills like cooking and cleaning to enhance independence? Vocational training, conceptual skills training, life skills training, social skills training. The answer is life skills training. And the life skills training teaches essential daily living skills such as cooking and cleaning, which are crucial for independence in individuals with intellectual disabilities. Next MCQ is which syndrome related to intellectual disability often includes obesity, insatiable appetite, and short statures? Angelman syndrome, Prader-Willi syndrome, Rett syndrome, or Cre-du-Chat syndrome? Answer is Prader-Willi syndrome. Prader-Willi syndrome is characterized by insatiable appetite, obesity, short stature, and intellectual disability resulting from abnormalities on chromosome 15. Next MCQ is which intervention model promotes teaching adaptive skills in natural environments where they will be used, such as home or community setting? Clinical skills training, school-based intervention, ecological approach, or laboratory-based learning? The answer is ecological approach. An ecological approach involves teaching skills in real life setting like home or community, making it easier for individuals to generalize and use these skills in their everyday life. Which type of therapy is especially helpful for individuals with intellectual disabilities to express themselves non-verbally and improve fine motor coordination? Physical therapy, art therapy, cognitive behavior therapy, or exposure therapy? Answer is art therapy. Art therapy allows individuals with intellectual disabilities to express themselves creatively and can improve fine motor skills, helping them communicate emotions and ideas non-verbally. Which category of adaptive skills involves personal grooming, feeding, and mobility, focusing on basic self-care tasks? Social skills, physical skills, practical skills, or academic skills? Answer is practical skills, and we know practical skills, also known as daily living skills, are essential for personal care, including grooming, feeding, and other self-care tasks that promote independence. Best of luck. See you in the next video. If you like this video, please mark it as such. If you have some question, ask it in the comments. And if you have not yet subscribed the channel, please subscribe the channel and share it with others.